Listen, I'm going to spend the next 20 minutes talking about our experiences treating almost 2,500 patients at Cedars-Sinai now with therapeutic virtual reality. And this is really about stories, and VR is a visual art. So I'm starting with an image. This is a picture of me with one of our 2,500 patients who we've now treated. And this young woman, who's allowed us to show her image, has lupus. She's frequently in the hospital, has severe abdominal pain. And this is the first moment that she's contemplating using virtual reality as a non-opioid approach to managing her pain. And what happens next is remarkable. And today I'll show you some examples of what happens when our patients travel to Icelandic fjords, or go to Hawaii, or sit on a beach while they're sitting in their hospital room. This is a photograph from one of our rooms at Cedars-Sinai Medical Center. We have the largest hospital in the Western United States, and one of the first hospitals in the nation to have private rooms. It's a beautiful hospital, but make no mistake about it, being in a room like this is not a place of rest. It is not a place of healing at all. Our patients suffer, often grievously. They suffer physically, emotionally, socially, sometimes isolated, stigmatized by their illness. I took a photograph of what our patients look at all day long while they're lying in the bed. And that's it, a television set, and there's two things on the ceiling. And then every so often, this view is interrupted by something like this. And there I am, not necessarily smiling, poking and prodding, asking questions like it's a court of law, right? And then, disappear, and then kind of come back again, and all day long, we come and go, and this is sort of the cycle of, being in the hospital. So we thought, man, there's got to be a way that we can use virtual reality to allow our patients to escape the four walls of what is really a biopsychosocial jail cell. That's what it's like. It's a biopsychosocial jail cell to be hospitalized in a hospital, to be in a hospital room. Can we use virtual reality to transport our patients beyond those four walls? And more than that, can we measure what effect it has on their well-being? Can we see if it can reduce their pain, reduce their need for opioids? Can it reduce their length of stay in the hospital? Can it improve their satisfaction with the care that they're receiving? This is a photograph of one of our patients who is in the midst of a sickle cell anemia pain crisis. So a very painful experience, as the name implies. But at this very moment, it's hard to see that. You can see this moment of cognitive immersion, where he's now recognizing that he's in an environment that he's never seen before. Usually about 4 to 6 minutes later, our patients enter this moment of physiologic immersion. This is where they sort of lie back, they just take a deep breath, and they sort of body language changes and they fall into the bed. And it's amazing to see. I can stand up here and talk about how our patients experience it, but it's much more compelling and important to see our patients themselves experiencing it. So I'm going to show you a video now, and we'll make sure that the volume is up, of two patients, not curated in any way, just happened to be two patients that were on the ward when we brought a camera up there. And doctor said, why don't you go down the hall and try it? One is this young man, and the other is an older woman who has cirrhosis and severe abdominal pain from liver failure. And in both cases, they're going to use virtual reality for the first time. So we'll see if it helps with the pain or not. Mm-hmm. You'll tell us.
Yes.
And we'll go from there. Okay, any questions about that?
Pull that down over your eyes now.
Should load up.
Whoa.
What do you see?
Horses?
Yep, okay. And over the bridge. Is that working?
Yes.
What's happening now?
The helicopter, waterfalls.
Mm-hmm. Have you ever been to Iceland?
No.
With the music and everything, it's real peaceful. Oh, it's people. Hey. Okay.
So what'd you think?
It's pretty relaxing.
Uh-huh.
Especially with the music and everything, and then the different scenery. Like, there was this one part where it was like a waterfall. You're sitting in a cave,
right,
and it's a waterfall right next to you. Almost made me forget I was here, like, cause you're there.
Right.
It's like you're really there. You're hearing the waterfall, and everything is like you look around and it's the whole scenery.
Right.
It's like you're immersed in it.
How did it make you feel?
Relaxed. Very relaxed.
Mm-hmm.
I wasn't thinking about the pain.
You weren't?
No, I wasn't.
Really?
I was just thinking about being there
Uh-huh.
and having a good time.
Uh-huh.
Yeah.
We'll let Dr. Herman know.
Okay, thank you. Thank you.
Good. Okay.
Yes, but I really did like it. I enjoyed it really much.
Excellent.
Thank you so much
You're
for
welcome.
taking me.
Okay. So that gives you a sense of what our patients have been experiencing when they use virtual reality at our hospital. And I didn't show you what they were seeing, but this is a screenshot of one of the visualizations. We have a library of over 30 different visualizations that is supplied to us by Applied VR. I don't have any relationship with the company, but we work closely with them. They happen to be in the demo hall today. And this is called Anxiety Reliever, where patients sit on a beach, looks like Big Sur. They can interact with their environment. And there's a mindful meditation script that they listen to while they're in virtual reality. But this is one of many different experiences that the patients can go through. We recently published this paper where we started with 50 patients, and we gave them a VR experience for just 10 minutes, and we measured their pain before versus after. And there was a reduction, but it's important in a study design like this to have a control group. And the control group was exposed to a two-dimensional visualization, a high-resolution, close proximity screen of nature, and there was music. And we did the same protocol with them to see how that would work. And in fact, that works too. That also helped with the pain, but there is a statistically significant benefit in favor of the virtual reality arm. When we looked at this a different way in terms of whether there is a clinically important response, there is a 65% response versus a 40% response, which is a difference of 25%. That converts into a number needed to treat, or an NNT of 4. For every 4 people that we treat with VR instead of a control, there's 1 additional person who has a clinical benefit. The NNT for opioids is about 4, between 3 and 7, depending upon what meta-analysis you look at. And this was without opioids. We've just completed a new prospective randomized controlled trial with support from Samsung in 120 subjects, where we followed them throughout their entire hospital stay. They had access to the VR throughout the whole course, and we've seen the exact same results, and we'll be publishing those results shortly. Okay. Now, the question that comes up is, how is this working? And we don't really know that. The human brain is infinitely complex. Every cubic centimeter of brain tissue has more neural connections than there are stars in the Milky Way galaxy. It's a statistic I didn't believe when I first heard it, but it's true. So for us to understand how something like virtual reality is impacting someone's well-being is hard to understand. But one theory is this gate control theory, which is an old theory, and this is the concept that we can distract the mind. You know, when a child hits their arm, or even an adult for that matter, we tend to rub it. And by rubbing it, we're putting in positive signals, not nociceptive signals, to kind of overwhelm the pain and confuse the brain. But the spotlight theory of attention is another theory. It's sort of a psychological theory that the mind can only take in so much at once, can only process so much at once. So if I were to flash a spotlight into the sky, you would look at that spotlight, but you wouldn't think about all the blackness around it. You'd be looking at what's inside of it. And VR is like flashing a spotlight directly onto the brain. The brain is trying to process all of this data and is almost incapable of feeling the nociceptive responses from the periphery, incapable of feeling the pain. And it turns out it's not just during the VR, but after the VR, we see a period, a refractory period, where it's like the brain has been rebooted, and we see a persistence, sometimes minutes, sometimes hours, sometimes even days, where the brain has been reprogrammed in a way and been nudged. And now we're starting to see it where people have, after 2 weeks of using it, don't need it anymore because they've learned how to summon, which is essentially mindful meditation, kind of off-the-mat yoga benefits, with having just summoned those sensations that they experience with virtual reality. Now, I want to emphasize that virtual reality is a therapy, which means it has side effects. It is an active therapy, and we need to be careful about how we start to use it as we engage more and more patients. I want to briefly tell you 2 stories. First, a story of how we treated a panic attack, and another one where we caused a panic attack with virtual reality. On the left was a young man, and I happen to be a gastroenterologist, so every so often I actually practice medicine, and we were called down to the emergency room to take out some chicken that was apparently caught in this man's esophagus. So we booked the operating room. We were ready to admit him to the hospital. And I go down and I see him, and he's gesticulating and beating his chest and going back and forth. And it's an unusual appearance for somebody who has a food infection. It's not an airway obstruction. It's a elementary obstruction. I thought, God, that seems sort of strange. I said, are you okay? And it was clear to me he was sort of panicking. And I wasn't at all clear that he even had food in his esophagus. So I asked him to drink some water, and the water went down fine. And it dawned on me he's having a panic attack and imagining a sensation of the chicken still being caught. It's a common condition, actually. It's called globus. So in the middle of the emergency department, and I wish I had a picture of this, but I couldn't for HIPAA reasons, we put him on a beach. And he was just hypnotized instantly. And I'm talking to him, and I said, listen, everything's okay. You can look around. He's not listening. I said, no, you can explore the area. No, he's out cold. After about 2 minutes, I was sort of getting concerned. I shook. I said, you all right? Are you all right? And no response. So I lifted up the headset, and a pool of tears had collected underneath it. And like waterfalls, these tears came straight down both of his cheeks. He was crying. I said, oh my God, are you okay? He said, I've been thinking about my life in there. My life is spinning out of control. My relationships are out of control. This can't continue. I can't live like this. I thought, man, I'm a gastroenterologist, not a psychiatrist. I can't imagine any psychiatrist come and do that in 2 minutes. It was overwhelming. It was amazing. So no, everything's going to be okay, and we worked with him. We're here for you. Rather than admit him to the operating room, we discharged him to psychiatric care, having broken a panic attack in 2 minutes with virtual reality. Amazing. Everyone in the ER was just staring at this. They could never see anything like it. The second story is a young woman who has had severe abdominal pain of unclear etiology for a long time. And we thought we would try virtual reality, and we exposed her to this sort of bizarre-looking game. It's called Pain Reliever, and it's designed for pain reduction. It's this distraction experience. And you throw these little balls at these strange-looking critters, and you knock them over, and it's a lot of fun. So she's in there, and she starts to cry. But these weren't tears of joy. She was very upset. She's crying, and she tears the headset off, and she's short of breath. She can't control herself. We said, are you okay? No, I'm not okay at all. Complete panic attack. We came to find out that she's had early adverse life events, that she's been physically, emotionally, and sexually abused. And any concept of violence, to be immersed in an environment where she has to harm even little bears, was enough to trigger a panic attack. Now, it turns out she's an actress, so the next thing we did is we put her on the stage of a Cirque du Soleil performance. And she cried again, this time tears of joy. She said she feels emboldened and powerful. When she's on the stage, she feels like a different person. She feels courageous. And she expressed all that to us within 10 minutes of having just told us that she was in a panic attack that we broke then with the Cirque du Soleil. So the mind, we know, is powerful. And what we're learning is it can be very powerful, virtual reality, to manage patients in ways we never thought possible. But we have to harness it and be very careful about how we're using it. So if VR is a therapy, then we need a VR pharmacy. We need to figure out how to pick and choose the right visualizations for the right patients. As a physician, I need to map the right treatment to the right patient. So we're working right now on an approach to psychometrically profile individual patients so that we can map the right experiences to the right patient, and so that we can avoid some of these experiences that I've just described. We've been tailoring the experience using the Samsung 360 camera, and I want to show you a video now, as I start to wrap up, of another young man. This young man has been in the hospital for over 100 days with Crohn's disease. And all he wants to do is be out of there. So this is a short video that NBC shot, where what we did is we gave the camera to his family, and they brought it home, and we can now live stream. So the patient was able to sleep in his own bed or be with his family at the dinner table. He lives with his grandmother, and he just wanted to be back with her in the living room. He loves going to the park and meditating, so we brought him to that park. Let's see how this works.
So when I was 16 in high school at St. Monica's, that's when my condition first started. I have Crohn's, or ulcerative colitis. It initially started with pain and bleeding. I mean, it just really limits me to rest a majority of the time. I spent about 100 days in the hospital this year, kind of managing the symptoms. And I'm a world traveler. That's my favorite thing to do, is to travel and to film. And when I'm here, all I do is just dream about going to my favorite places. And when they came in yesterday and I met with the doctor and his team, I was just, it was like an answered prayer. It was like exactly what I had been asking for. And as soon as I put the headset on the first time, it was like I was on a beach. It was like I could smell the sound, I could hear the sounds. Oh my gosh. There's my grandma.
Good morning, Harmon. This is Nana. I miss you.
Way behind you.
Yes. I feel like I'm sitting in my living room. Oh my gosh. Thank you so much, Sai. You have no idea.
Virtual reality, it's just a platform. What matters is what goes through it, right? The visualizations, the content. So what we're learning is that different people have different expectations. And there's no one perfect prescription, if you think about it. So if virtual reality is a therapy, we need a VR pharmacy.
It just takes you away from the pain for, even if it's just 5 seconds, So I think it can be a new form of pain management and pain treatment if we continue in the right path. The breeze is blowing through. I'm sitting at the top of Kenneth Hahn, and there's downtown. There's the Hollywood sign. And there's my house. This is just surreal. The sun is beaming down on me. Like, I almost feel like I can feel the rays. Oh man, I'm a tech guy and I'm a young techie, but I never thought technology would come this far as health is concerned. Not in my lifetime.
So again, it's compelling to hear from our patients. And you may have noticed that he said, you can hear the sounds, you can smell the sounds. I don't know if you caught that. He smelled the sounds. It's a form of synesthesia, almost crossing sensations, opening up latent capabilities. He may be synesthetic, I don't know, but he smelled the sounds. That's what he said. So it's been amazing to see this, and this NBC video has 4.3 million views, and I show that not to sound self-important, but rather to tell you that since I'm a researcher, we turned that into a research project. And we're just about to publish a paper based upon the 2,500 comments that we received. And it turns out, when we looked at those comments, people have all sorts of fantastic ideas for how to use virtual reality. And this on the screen, not meant to you necessarily to read in depth, is a blueprint for the future of therapeutic VR research. And we'll be publishing this. It'll be an open access study. And as you kind of peruse it, you'll see there's all sorts of fascinating concepts that people have. Most recently, we've been in the outpatient environment, and we've used a VR experience to manage blood pressure, specifically culturally tailored for African Americans with hypertension, education about salt reduction. We worked with Pastor Kelvin Sauls of the Holman United Methodist Church, and he sees his role as a spiritual leader and a health and wellness leader. And we're able to actually reduce blood pressure by 7 points, systolic blood pressure, over 12 weeks. The patients go into this kitchen, they learn about where salt lives in their diet, and then they fly through their body and see how it's affecting their kidney, brain, and so on. So I have 1 minute left, and I want to show you a 1-minute video, so the timing is good, because I know Daniel's here and watching. And this is the world's first CME lecture, given completely in virtual reality to an audience of about this size. About 3 weeks ago at the American College of Gastroenterology, I worked with Medscape. And I'm blindfolded through the entire thing, but what I do is I walk through the slides, and I'll just show you very briefly what this looks like.
Mode, because we're looking at quite a bit of action here. I've got this brain in front of me, and wow, look at all that. And all these different brain networks that are surrounding this sort of central image. So explain to us, Lynn, what this is all about and what this has to do with IBS. And this is sort of showing the brain-gut axis now in real time. And what we're going to do here is we're going to zoom in close on the spinal cord itself and just sort of demonstrate this concept of descending inhibitory pathways in an animation. So we're going to sort of open up here the spinal cord and get inside of this thing. And we can see sort of the pain signals coming up. And then we have these 2 little yellow things that are kind of these virtual gates. So, what are these virtual gates, Lynn?
So I'm talking with my colleague Lynn, who's in real reality, and I'm in virtual reality. We're going to have a meeting in March 28th and 29th, and Daniel actually will be speaking at the meeting, so thank you very much, Daniel. It's a meeting called Virtual Medicine. We're bringing in the world's experts in therapeutic and medical virtual reality. Several of the speakers today will be at that meeting, and you can find out more at virtualmedicine.health. So since I'm from Hollywood, I have a scroll to finish my presentation, and I just want to emphasize that when speakers come up and give talks like this, sometimes it sounds like we're the only ones that did the work. I stand on the shoulders of giants, the people that have done the work in virtual reality to allow us to do this, and a whole bunch of people from my medical center that helped this become a reality. So enjoy virtual reality and also real reality outside later today. Thank you very much for the opportunity.
So amazing work. This is really on the exponential. I mean, we're just in the first couple of generations of consumer-based devices, and there's going to be magical in the next couple of years. Many folks here might want to start building VR applications. What's the best way for them to start doing this, even if they don't have great technical ability?
Well, it takes a lot of work. The key is to start with patients, right? What I'm seeing is a lot of VR experiences where patients were never involved in any way, shape, or form. So human-centered design principles. So we can talk more about that. We're going to have a breakout later this afternoon. For those of you that are interested, we can talk in a lot more detail about how we actually design these and implement them.
Right. The theme there, patients included, right?
That's right.
All right.
Yep.
Thanks, Brennan.
Thank you.